85% of the people who've used telehealth during the COVID-19 pandemic last year had a household income of over $150,000. However, the true potential of the digital health revolution is to actually transform care for those most in need. So to tell us more, let's bring in Nick Desai, the CEO and co-founder of HeyRenee. Thank you so much for your time today.
Great to be on. It's a pleasure.
Now, we know that telehealth has been essential for the healthcare industry. Can you tell us exactly how it's actually aiding this care?
Well, telehealth has always had the potential to connect to rural patients farther away from doctors, patients who don't have transportation or access in countries like India where there aren't enough doctors, even here in the US where certain parts of the country don't have enough doctors. But during the pandemic, it was the safest way to see a doctor because you didn't have to be exposed to other patients. You're in the privacy and safety of your own home, not being exposed to the COVID pandemic or any other virus from any other patient.
Yeah, the popularity has definitely skyrocketed when it comes to having these virtual, doctor appointments known as telehealth. Now, do you think they're just as good as being in person, seeing a doctor in the flesh?
Look, there are certain things a doctor can do in person or healthcare can do in a person that they cannot do virtually. Lab draws, giving you a COVID vaccine, measuring your vital signs. These are things, and a physical exam are things that require an in-person visit. Now, there are many, many ways to get those things done that a doctor does not have to be involved in. You could send someone to my house to draw my blood, or I could go to a lab or something, but a doctor is able to deliver a preponderance of care in a telehealth setting that they do in an in-person setting. And in fact, I just read today that doctors in the US are their average telehealth visit is actually about 30% longer than their average in-person visit. So they're actually spending more time with the patient because the doctor also isn't hurried because you can stretch the day. The doctor might be able to take a break in the middle and is not worried about a waiting room full of patients. So telehealth provides a great forum for patients to be in their home and doctors to ask more personal, more intimate questions about food, about lifestyle, about diet, things that dramatically affect a care plan that a doctor might create for an individual patient.
Now, Nick, over here in Australia, we get free healthcare and access to telehealth because of our publicly funded healthcare insurance known as Medicare. Now, this obviously isn't the case for you in the US and other parts of the world. So what do you think about this? Should you perhaps join Australia's lead and make it free for all?
Well, yes, we should join Australia's lead in a lot of different things, not just healthcare, also the way your government has acted very, very swiftly on gun control should also be a role model here for the US. But I'm a huge proponent of Medicare for all or coverage for all. And the fundamental reason is that when you think about insurance as a business, insurance works very well in businesses where the buyer and the seller don't want you to have to use the product. When I buy life insurance, I don't want to die and the life insurance company doesn't want me to die. When I buy fire insurance for my house, I don't want my house to burn down. Healthcare is something we should actually encourage people to use earlier in the disease cycle. It's like education. The more we educate people, the better off they are later in life. The more preventive healthcare we provide to people, the less we'll be dealing with high cost problems later, many of which are avoidable or at least treatable more cost effectively. But the US healthcare system creates a weird disincentive to use healthcare where people think I should wait till I'm really sick before I go to the doctor, and then it's often too late for the doctor and they end up in a hospital, which is a very costly place to get healthcare.
It's quite crazy to hear that and the amount of fees that even people that are unfortunately who have had COVID have had to pay for. Everything here is free, and I think, hopefully with time, you guys in America will follow our lead. But telehealth in general is such a great initiative, so thank you for bringing that to our attention today, Nick.
Yeah, telehealth is a phenomenal transformative asset, no matter if you're in a Australian system, India, China, the US. It really has the potential to bring health equality and health equity to patients of all ages, income levels, and demographics. More people in India, my home country as an example, have data-enabled cell phones and have access to toilets, right? So it is a truly transformative technology, and I hope to see it proliferate and be a part of that proliferation.
Me too. Thank you so much for your time, Nick.
Thank you.